Is anyone waiting in the room already? Hello? Hello? Do we have anyone in? Hello? I can see we have one person here. Let's wait for others to join. Okay, I'm gonna just get. It looks so blurry, sort of. Let me see. See. No, that is worse. Hello, 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 hello. Hello, skilled fans. Let me know who is here already present. Hello. Anna. Anna, you are here. I can see you, Anna. Welcome to our first live. Hello. We are waiting for others to join. We have 2 people in the room. Hello, this is Skills Made Easy, our first live. We're going live for the first time. It's going to be an interactive section with all my subscribers that are joining, okay? I don't know, can you hear me? Okay, let me see if I can see your messages. Oh, okay, Anna. Anna is here. Anna, you're welcome. Anna, you need to comment. Yeah, you need to comment. You need to ask your questions and you will get answers. That's how we go. You don't need to go live with me. Waiting for others to join. I can't see Alexis right now. Okay. And I hope you can see me. Can you see me? Can you see me, Anna? Let me know if any one of you can see me. Let me see. We have people coming in, joining us. Let me see who is there. Oh, we have Michael Lunge, right? Uh, she's here. That's good. Who else do we have? Okay. Yeah, let's give others time to join. We are doing great. Someone, Alexis is here. Good. Where are the others? Yeah, Alexis is here. Good job. We're expecting more people. So we have Alexis, Anna, Michael Lunge. I have to plug. Hold on. Someone should comment yes if you can hear me. If you can see and hear me, comment yes. I can see you. I can hear you. Awesome. 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 Good job. Okay. I think we're just like few minutes away from the actual scheduled time. Not bad for the first time. Trying to study this. All right. Anna says she can see and hear me also. Good. Okay. So while we're waiting for others to join, how do you guys feel about your career so far? What are the challenges you face or you are still going through? You're facing, and what have you done about it? Let me hear you guys. Let me know what challenges you went through while in class during the course, and what are your hopes going forward, taking your state exams and all that. How were you guys able to join? Maybe others are having difficulty knowing how to click through. Was it difficult to like get through? Let me see who. No, just click on the video. Oh, okay. Okay. So others know they should just click on the video. All right. So let's chat. Let's talk about how your um 3 or 4 weeks went through, and know you guys are preparing for your exams. What are your greatest fear? Let me see what Alexis said. No click, okay. Oh, someone else joined us. Who is that? We have, let me see the name. Is it Amelie? Okay, we have people coming, joining. Good job. Awesome. So I was asking, yeah, someone else joined us. Patience. Is this a patience? Okay. Challenge I had was, Alexis said, challenge that I had was remembering when I go into skills testing. I get nervous and forget everything, or my mind goes blank. No, Alexis, I've got your back. This is not going to happen. This is not going to happen. We're going to have a clue on how to deal with that right here and now, okay? So that is not going to happen because you have the potential already. So nervousness is not going to be an issue. So the way you can minimize being nervous and not forgetting what you already know is challenging yourself to know that you don't want to come back to take this exam. You don't want to go through the stress. It's not worth it. If it happens, fine, but you need to do your best. Know that if you are nervous, nervousness is going to rob you of success. And that is not what you want. So that is one thing. So being prepared will help minimize that nervousness that you're going through. If you are not prepared at all, if you have not been practicing, or you still don't have time to practice, maybe you have to go to work today, tomorrow, or the night before your exams, then you have to worry about being nervous. but you have time now to like plan your strategy, how you're going to coordinate yourself individually now. You don't have to think of your colleague, you don't have to think of your classmates. Is now I'd advise you to be selfish now. Be self-centered. Think about yourself now. So how prepared you are is going to be tested by you. So if you are testing tomorrow, you take this night to like prepare yourself, time yourself, and perform some of these skills that you know that they may be a problem or challenge to you. Set a timer. When you are done performing that skill, know how many minutes it took you to perform that skill. That will help you to know if you need to better up or you are in line with what is expected. And try not to look at your examiner. That's another thing. You only, when you need to ask her questions or him questions, you can. If she is asking you a question, you can turn to look at her. Other than that, you need to focus on your resident. Talk to your resident. That helps to calm whatever nervousness that you came into the room with. Hi, how are you doing? My name is, I'm going to be your CNA for today. All that moving around, talking, greeting, introduction, it helps to calm your nerves. Alexis, are you feeling better? Okay, yeah, she said thank you so much. I know it's not going to be an issue for you. Once you have that potential, you don't want that nervousness to rub it. It's okay to be nervous. It's normal to be nervous during exams, but don't let it get the better part of you, okay? Because you have to be in charge. Talk to your resident, be interactive with your residents. It will help calm your nerves. Do we have other people joining? Let's see. Okay. Yeah, so let me hear from others. Let me know what do you think is something that you need to talk about, your concern going in for your state skills exam. Let me see who. Anna says, I am scared. Range of motion. Okay. For range of motion and remembering everything for that is partial range of motion. Okay. So I don't know if you've seen my video on range of motion. So passive range of motion. I don't know if you've seen my video on range of motion. It's very, very quite explicit. If you watch the video, it's just going to calm your nerves. You need to say the word, what you're doing, you need to say flexion, extension. You need to mention it. You can't just keep moving somebody's hand back and forth and your examiner doesn't know if you're in your mind you are saying extension when you are demonstrating flexion. So when you go this way, you are flexing. Extension is like that. Remember, when you forget or get confused, like some students do during at the die minute, they just like, oh, is this flexion or extension? They get confused. When you are in that state or position, what you need to do is to think about how do you, if you meet a friend on the way, how do you extend your hand to give the friend a handshake? Extension. You do not do this to greet. You extend your hand. So that is a way to remind you that extension is outstretching your hand. So flexion is this way for elbow. So like on the video, I broke it down to, that is, I had to divide the body into different parts. Breaking it into different sections helps you to know when you are asked to do a particular part of the body, which is obtainable during the exam. They may not want you to do the full range of motion. They will pick a particular part of the body, or they may say upper extremities. If they say upper extremities, they mean everything on the upper section of your body, which we know we don't do range of motion on this part of the body. We do range of motion on the arm. So if they say upper part or upper extremities, they mean shoulder, elbow, wrist, your fingers, and possibly your thumb. So that is what upper part entails. If they say shoulder, they want you to just do shoulder. That would be flexion, extension, all the way back. Flexion, extension. Then abduction. You are taking the arm away from the body, like someone being abducted. So those things, go back and watch that video. It will even teach someone who is a first timer how to do range of motion. So that shouldn't be a problem to you at all. Anna, does that answer your, or like calm your nerves a bit? So if you cannot remember the names of everything, but at least 80% of the name, you need to know them. You need to know. You can't just go on someone and just go dumb, not saying nothing. Remember that the residents, if you are not communicating, they are kind of nervous. They don't know what's in your mind. They are scared. This person, I don't know, this person that is not talking, she's just moving around the room, or doing something on me and not chatting with me. I'm scared. So you need to be interactive as an NA or a CNA. You need to be. Let me see whatever other question. Is that Becky? When doing, hold on. I don't know whether to put the slide on it. So when doing occupied bed and folding the soiled linen, wouldn't it be infection control when it touches the resident? When doing occupied bed and folding the linen, wouldn't it be infection control when it's... So what do you mean by when it touches? Do you mean the dirty linen or the clean linen? Clarify that so I can give you a definite answer. Okay, that's Becky. Clarify your question. Let me know. Are you talking about the dirty sheet or the clean one? Anna says, I can't fully pronounce what dorsiflexion and plantar flexion I stutter saying it. So it's fine. It's absolutely fine. If you stutter, it's not something you can it's not something you can control. You're not in control of it. So they're not going to penalize you because you start. No. She will wait for you to let it out. Or so, even if you struggle with the language, most times you can try as much as possible to just verbalize what comes out of your mouth. As far as you're doing that, you are demonstrating the right thing. You're pronouncing it, not pronouncing it like correctly, but let's say dozy flexion and you call it dozy or dozy flexion, that it's okay. I mean, they know some of us have language barrier, so it's okay if you stutter. It's not a problem. It's something you cannot control, so it's fine. All right. Okay, Anna. Alexis says, what are the names for the foot range of motion? Right? For the foot, so the foot, so let me start from do you want me to start from the knee, or do you want me to just go to just the foot? If it's for the foot, we have flexion, extension. So that's the last, if you mean the last part of the body we're going to do range of motion on. Flexion, extension, abduction, adduction, abduction, adduction. But if you're talking about the ankle region, it's different. So Alexis, can you specify exactly? So yeah, specify exactly. Becky said the dirty linen. Okay. So you want to know if, let me go back to your previous, when doing occupied bed and folding the soiled linen, wouldn't it be infection control when it touches the resident? No. So when you talk that dirty linen, remember you're first of all going to roll the resident on lateral position before you start to roll the dirty linen. And you are not rolling the dirty linen to, you are taking the bottom part on top, not the soiled, the actual soiled part of the linen. You are folding it inwards, so the dirty part is covered. I don't know if you understand what I'm saying. So you are folding the sheet this way and not the other way. So the part that was on the mattress is going on top, not the surface that you came in contact with when you first came into the room. If I have something to demonstrate, so give me a few minutes. Let me get like a napkin to demonstrate what I'm saying. Okay, I'll be back. So Becky, this is what I'm talking about. Hold on. This thing is trying to prove something. So if this is my linen, I hope we can see. if this is my linen, when I'm folding it under the residence, I'm taking it under the out, and I'm going like this. Do you understand? So this is the soiled part that is under the resident, and the other part that I'm rolling is the clean, that the part that is not that soiled. So you roll like that. Does that answer your question, Becky? Okay, you're welcome. She says thank you. Okay, let me see if I'm missing anything. If I miss your question, please keep asking until I answer. So I'm going to go back and see. Okay, from the knee. You said from the knee. So range of motion from the knee. So from the knee part has just one, you can only move it in one direction, and that is you flex it and you extend it. So for knee, you say flexion, extension, and that's, you're done for the knee. Then the next part is the ankle. The ankle, you go, for the ankle, you do dorsiflexion like you did for the wrist. So you dorsiflex by pushing it backward like that, and you, instead of doing flexion now, because it's the ankle part, you do plantar flexion. So dorsiflexion and plantar flexion for the ankle. So for the toes, you do flexion, extension, abduction, adduction. But for the ankle, you have two. Remember, we have two exercises for each part of the body, except the knee that has one and the thumb that has three. So for the ankle, you have that dorsiflexion and plantar flexion. And the second one is supination and pronation. So you are trying to twist the foot inward and outward like that. All right? So those are the three parts. We didn't include the hip because you said from the knee down. Does that answer your question? So the names, again, let me repeat. For the knee, you have flexion, extension. So just one way, flexion, extension. You flex the knee and you bring it back. You flex it and you extend it. That's for the knee. Then for the ankle, you do dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. That is one for the ankle. The second one is supination and pronation. Supination and pronation. Supination and pronation. Remember, supination is like facing upwards, and pronation is downwards. That is what will remind you. Then when you get to the toes, you flex the toes, you flex them like you did for the fingers. So the same exercise you did for fingers is the same you would do for the toes. It's same exact, just that the body part is different. Does that answer your question? Let me see. Okay, I want to know how I will handle the graduating cylinder during bedpan. Where do I put it before transfer? So for bedpan, you have to make sure if your examiner pours like a liquid in the bedpan, so you know you need to empty it, you need to go to the bathroom. Do not place it on the table. Do not place it on the table. Take it to the bathroom and put it at the back of the toilet seat, that white slab behind the toilet. Put a paper towel there and place your cup there, and you can empty it in there. Don't hold it in your hand to do that. Okay? Except if your examiner tells you otherwise, but don't place it on the table. Don't place it on a clean surface to empty it. It needs to be on a dirty surface. Does that answer your question? Okay, good. Becky says thank you. Okay. If I miss your question, please ask again. All right, she said thank you, Sarah. Okay. Keep the questions coming. We want you to have 100% in your exam. So whatever you feel is hindrance, let it out. Whatever you feel is going to hinder you, let it out. Let me see, someone has a question. Becky says, can I open a drawer with a clean glove, or do I have to use a tissue to open whenever getting supplies? The instance with bedpan and putting away materials. So starting off, when you're just starting off, you don't really need glove to bring the supplies out. You need glove when you must have used the supplies. If you need yeah, so you need gloves more when you must have utilized the supplies and trying to replace it back, or during utilization of the supplies, when you're using the supplies. And you always need a barrier, like a paper towel. If you know that you've used your glove and you have that glove, the wet glove on, you need a barrier not to touch the drawer directly with that glove. You need a barrier to open now and to put it down. But when you are just setting up your supplies, you can, but not when you want to pull out the bedpan. Remember that the bedpan, like I always say, grab the bedpan when it's needed, and at that point you already are in the know-how. You already are in the process of getting the residence set, so you have your glove on, so you can open the drawer and get it. Who else has a question? Okay. Does it matter how? So this is Alexis asking, does it matter how you space the denture, how you place the denture in the cup, or for denture. Okay, okay. So which, whatever denture you remove first, which is the lower part, you place it down first, because you cannot take out the denture and hold it in your hand to take out the top before you put it. So whichever one you take out, secure it in the cup. So the bottom one is the first you take out, so put it down in the cup. Then when you do the top one, you put it there also. Okay, so it doesn't really follow any order. So if I may ask you guys, which of the dentures do you wash first? Which one do you take care of first when you go to clean it? Which one do you take care of first? Okay, someone has another question. Alexis, I hope I answered your question. So Amen says, yeah, so you take the bottom one first. So, and is the bottom one you're taking out is the one you're gonna wash for. It doesn't matter, just find your way to getting it out. It's not a big process. All right, because the denture is very delicate. You cannot take it out of the resident mouth and you play around with it or keep it somewhere. Yeah, just put it in the safe, in the cup. You take out the, okay, all right, we know we take out the bottom. That's good. That's, we clean the bottom first. Yes, you clean the bottom first. Yes, so you clean the bottom denture first. And do you have to clean the do you have to rinse the cup and also the cap, or just the cup? You need to clean the lid also. Is it necessary? Is it necessary for us to clean the... Becky said, yes, because you touched exactly. So we need to clean. So sometimes students forget, they just rinse the cup and they put the denture back. No, make sure you also rinse the top, the cover. And when you are placing the cover, do place it inside facing up. Don't put it downward like that, okay? Okay. Alexis, you know so. You don't believe so. You know so. Okay. What do we have here? That's Abbas. Abbas says it is necessary to clean the cup and the lid. Exactly. Exactly. It's very important. We don't want to be faulted. Infection control. Infection control is key, is basic. Okay. Keep the questions coming. Is our anxiety level going down? Is this helping us? Becky says, what's the angle of the head of the bed when doing? Awesome. Very good question, Becky. So the angle of the head of the bed, we are going to I'm going to ask us some questions, and we all will arrive at a particular. Is it looking dark? Are you guys seeing me very well, or do we need light? Is it okay? Is it looking good? Is it bright enough? Let me know if it is bright enough so I can continue. I can answer the question. Okay, so yes, you're looking good. Okay, awesome. Okay. So for the question that Becky asked about the head of the bed. So if you're doing bedpan, if you're giving a resident bedpan, let's look at it this way. Why do we have to bring the head up in the first place? Who knows why? Who can tell us why? Why do we do? Is it important for us to bring the head up? Why do we have to bring the head up? Alexis said, for, yeah, there are some cases of specific consigns of people who have that as aspiration like that. But Abbas says it's more comfortable. Okay, when you, okay. So comfortability is the major reason, because it's very, very, very difficult for someone that's to use the bathroom that is in bed. Is very, very, very uncomfortable. So we are trying to make this resident as comfortable as we can. Please ignore the noise there. So you want to make the person feel very comfortable using the bedpan in bed. So now we know the reason we are raising the head up, to make them position them properly. So for you to know the angle, who is the one using the bedpan? Is the resident, is not you. So the resident knows her comfort level, her comfort level. So you need to find out from the resident. I'm going to be raising your head up. Please let me know at what point you're comfortable. Because he who wears the shoe knows where it pinches. So let me know at what point you're comfortable so I can stop. So you keep raising the head up when it's the time. When she's balanced on she feels more comfortable, she will say stop. Okay? Does that answer your question? So there's no actual angle for raising the head during bedpan. because you can put the bedpan based on what you feel is comfortable for the resident, but it may not be. But in case of people who cannot talk, those people who are not in the right state of mind, then we can use our discretion to do that. If the person can talk, find out from the person when he or she is comfortable. I hope I answered your question, Abbas, right? Let me see who else. Okay, she says thank you. To make the residents, okay, so someone was contributing to that, yeah. Okay. Yeah, it's more comfortable to be in sitting position when using the bathroom. So yeah. So everything boils down to making the person comfortable. I remember you don't have to, it's not just the head you raise. You also have to raise the person's foot a little up so that he or she will be like inside, tilted inward, so that they are more balanced. Because you already asked the resident, you already raised the resident's knee, you already bend it backward, but he or she is going to get tired after some time and that knee is going to drop. For you to make sure she's still comfortable using the bedpan in bed, you use the foot, the remote, or whatever control you have by the bedside to elevate the foot section so that she can be comfortable even when she brings her knee down. All right? Let's, if you are enjoying this live section so far, make sure you click on the like button. Let me see how many likes. Click on the like button. Why is this? Okay. Have we done that? Click on the like button. What parts are cleaned during partial bed? Is it bed bath? Do you mean bed bath? So for partial bed bath, they are going to specify if they want you to do the upper part of the body or the lower part. So the upper part includes the eye, the face, the neck, down to the abdomen region. Then from the hip down is the lower part of the body. So they're going to specify which section they want you to do, or if they want you to just do the face. Okay? So that is partial. It means that you're not doing everything. You're not doing full bed. You're not giving the person full bed bath. So upper section involve everything in the upper region down to that, the abdomen region. So don't worry about that. They will specify, they will let you know. so that you are not doing everything. That question came from Becky. Is the like button showing? Can we see the like button at all, or is it? Let me see your, let me see a sign if you want us to go live like often to like help more students. Let me see your hands. Or say yes or yeah, anything. Okay, good. Alexis says, when transferring a resident from bed to chair, where do you stand, in front of them or the side? Okay. So when you're transferring a resident from bed to chair, you stand in front of the resident. Stand in front of the resident with your feet in a V shape. So, hold on, let me. So you're going to have your foot like this to block the resident's foot so that if he or she wants to slide, there won't be any space. So you have that, your foot like this in a V shape. All right? So stand in front of them. That's how you'll be able to bend your knee to help them up from bed. Block their foot at all times. Alexis, does that answer your question? Okay, Becky, I have a message. Oh, Becky, you deleted the question. Are you good? But Alexis, if you want to put the resident back, there is a point when you want to sweep them back in bed, you cannot be in front of them. Now you have taken them back to bed in case they say transfer back to bed. You can't be in front of them to sweep them their like back. You have to be on one side, but you have to block them this way this time. Block their foot with one of your leg on a horizontal way so that you can go like that to put them back. But when you are trying to get them ready to transfer to the chair, you be in front. Only if you guys are two assists, then one on each side. But if you are just one, you'll be in front of the resident at most times. Okay. Oh my God. Sorry, guys, for that. Okay. No what. We are really learning a lot today for the first. It's not that bad for first time, right? Not that bad. Okay, let me see who else have a question. Becky said, whenever we want to measure body fluid, can we take a tissue and put it on the sink to measure on it, or do we always have to put it on the back of the toilet? So do you mean putting a tissue on a table, on the bedside table? Or you said sink? No, do not use the sink, because the sink, we use the sink for different purpose. People go there to grab water, some go to get water to boil for coffee, some go there to wash their hands, it's what they use the sink for is very numerous. So you don't want to go contaminate it with urine. Because somebody can come there, or a kid can just come there and touch, We know that when we are washing our hands, we are advised not to let our body touch that area. We know that, but um, putting urine there, I don't think is ideal. When we have a very good place to put it, the back of the toilet is best. So that area where we have the toilet is good. So we always want to stay out of trouble. You may do it, you may put it around the sink area and not get penalized. I don't know, but I'm all about easy way and like more accurate way of staying out of trouble. That's what I'm about. That's what the channel is all about. Okay, someone asked a question. Let me see who is that. When did you say feeding? What about feeding? What question do you have for feeding? Can you be more specific? Let me know. What question do you have for feeding? Yeah, feeding is part of the skills you should expect. Yes. Yeah. So what exactly do you want to know about feeding? says, okay, do we have to place a barrier on the table? Yes, you have to place a barrier on the table at all times. Before doing, place a barrier on the table, just to be on the safe side. The table is supposed to be one of the cleanest surface, which I think is still a clean surface, but sometimes people just touch the maybe like fluid from their nose or whatever, and the next point of call is the table, or they clean their face and they come rest on the table with their hands. So that's like a contact, they transfer, or droplets. So that's why we have to cover the table. But if the food is in the tray, I don't really think it's much of a problem if it's in the tray, placing it there. But just to be on the safe side, we have tablecloths. It doesn't have to be towel. We have covers. So you use the table cover to place on the table. So that will serve as a barrier. So barrier doesn't have to be only towel, like some of us think that when they talk about barrier, it has to be towel. So when you're talking about food, you use a table covering to do that. Just like we have in the dining room, you won't see them using towel on the table. They use something different. You're welcome. Alexis, can you get the names of people who are on the live and send it to me later? Have we sent our anxiety and nervousness away at this point? Are we getting better, or are we better? So Alex said, everyone, please comment your names. Okay, right. Can we use the cylinder to clean the bedpan after we empty it and clean it, or do we need to use a disposable cup? Is the best to use, because also the this cylinder or the measuring the cup, urine cup, you cannot place it under the sink. It's not ideal. So when you want to wash that too, you also need the disposable cup. Is best, and you will have it around there for you to use. Okay, so use a disposable cup to get water and soap. Becky, well, it's slowly getting better. So what else? What else is giving you chills? Let's deal with it. Let's bulldoze it right now. Someone said I'm here. Who is that just joining? Is that is it Cheyenne? Cheyenne? Cheyenne says I'm here. Okay. 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 It won't let me make a channel. What do you mean by it won't let you make a channel? Oh, okay. It didn't let you comment. Okay. But you're true now. So go ahead and comment. Go ahead and answer your question. It said I couldn't comment. I'm making a YouTube channel. Oh, until making a YouTube channel. Are you subscribed? Oh, okay. So food care can mostly can be on a live person. If they're going to give you a dummy or a mannequin, they may want to put the mannequin in on the chair for you to perform the food care. But majorly what we've seen so far is the live person. You have to do the food care on the live person. Yeah. And do not forget your supplies. Know your supplies. For food care, don't forget you have to put on a new stockings for the person. So you have to get a new one. Sharon wants to know, um yeah, most times they have the person sitting in the chair because if you are not being tested for transfer, they may not want you to do transfer before doing the residence. But if it is included, then you transfer the person and also do. And make sure you perform the foot care on the parts. If they say the right foot, make sure it's the right foot. If they don't specify, then you go ahead and do anyone. So Sharon also wants to know, will I have them do it in a chair? Okay, with a protective pad. Yes, you need to place some like a disposable chalk on the floor while the person puts, or if there is none, you can use a bed protector and the resident place their foot on it. Then you also put your supplies. Then you put your basin so the person can soak the food. Is food care just the washing of the foot, or just like nail care? So foot care is like nail care. The major difference between the two is for foot care, you're not using orange stick or emery board. You're doing everything just like you're doing nail care, but you're gonna soak it. You're gonna soak it for longer than nail care. And also um you're not gonna put lotion in between the toes. No. So Becky wants to know, will we get penalized if we forget to take out the what, the denture glue on the dentures before washing? The excessive, okay, excess. So what you're actually taking out during the washing, for most of for most part, is the food particles, not necessarily the fixodent, what we call it fixodent, what you use to glue, to add to the denture so that it can hold in the resident's mouth. When we are doing the scooping now, before we clean the denture, we are trying to take whatever food particle is stuck in the groove of the denture. Okay? So when applying fixodent, we have to apply it. Some people don't know how to apply it, and it becomes a problem when it's the time to clean it. If you're facing difficulty in taking out the fixodent, it has to be soaked so that it can soften a bit before the person cleans it in the real life setting. Cheyenne wants, let me see, so basically soaking the foot, wash, pat dry, and ask if they want lotion, but not between the toes. Yes, since we will not be using the emery board. Yeah, exactly. You're not using the emery board, you're not using the orange stick for the foot, for foot care. Yeah. So you wouldn't need to wash it twice. You know, for nail care, you wash twice. Since we are not taking out that, we're not using the orange stick, we are just washing the foot once, okay? Wash, rinse it, and pat dry, then apply lotion. Then you put on a new stockings for the resident. You guys should not forget that you are also going to be tested on how to put on compression stockings. So make sure you watch the video on that. It's a simple way of doing it. It's on the, we have a video on that. After doing what? Okay, let me see. Someone have Michelangelo says, after doing foot care, do we have to put socks? Yes. Yes. You have to put socks, shoes, except your questions require you to put on shoes. We may not need to put on shoes, but you put on the socks for the person. So sometimes they are very specific on what they want you to do. So you go by the instruction. Remember, it said infection control, safety instructions. They are very, very important. For partial, so, oh, Cheyenne said, I understand now. Good. I'm glad. Becky wants to know, for partial bed bath, when we clean the arm, does that include the fingers, or is that only part of nail care? So you also would take care of it's part of the you include everything, but you're not doing it like you're doing nail care. You're just going to soak it, get it, wash it, and that's it. Okay, so if it's nail care, you're not going to deal with taking out the dirt from the finger and all that. But if you're doing this thing, you soak it, wash it. You're soaking it so it will soften whatever dirt that is hanging around there. So before you wash with soap and rinse, pat dry. Did we, like I asked the question, if we are seeing the like button, is it showing or not? Is the like button showing, like the where you can like? Can we see hear me? Can we see the like button or is not showing? Let me know. Okay, it's showing. Okay, so we have, okay, good job. Okay, I can see the likes. Yeah, good. You have to come out of the comment section before you can see the like. Okay, good. Thank you for that information. That is let me get your name right. Is it Anna Tamufor? Thank you for that information. That helps. Are we ready for the exam? For those of us that are taking our exams soon, are we prepared? Okay, patience. Okay, I got you. Thank you so much. Okay, let me get the feedback. Are we prepared? I don't know when this is going to go off. The life is going to end soon for today. So we may be having another one tomorrow, but we need to vote on if we want it and the time so it can be communicated. Okay. We should. Okay. Good. Let me have more answers to that so that we can know if it's worth it. So if we agree on a time, I'm gonna schedule it on the channel. I'm gonna broadcast it to let us know what time tomorrow. But we need to let me know we are interested in it, so that's it. So okay, Alexis did thumbs up. Yeah. So, a piece of advice. So, go into the exam room for those of you who are testing very, 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 very soon. When you get into the exam hall, go in with confidence. Okay. Okay, someone is trying moderate. Okay, good, good, Otis. Yes, okay. So while we're doing that, a piece of advice: do not be scared. Go into the exam with confidence. Most of the skills that you're going to perform on the resident is something that you do for yourself. So denture care, we brush our teeth every day. The difference is that this resident cannot do it herself. You are assisting the person. So when you forget something and you remember that you always have a sip of water, you always must in your toothbrush, you must in your mouth before you start brushing. The same thing you do for the resident. It's not different. So it's as easy as ABC. So don't be stressed out. When you're doing bedpan, when the three questions which students find difficult remembering, you don't need to stress yourself. You don't need to memorize. All you need to do is to remember what you do for yourself after using the bathroom. Simple as that. The only thing you don't know ask yourself is, were you successful? Every other thing, you wash your hands and you wipe yourself. So that's the same question you're asking the residents. We really did good. It was so interactive. This section was so interactive. It doesn't even look like it's the first live section we're having. It's fun. It's very lively. Everybody contributed. No one just came to like listen. Everyone was in very active in the interaction, which is very that's and give me that encouragement to keep putting out things like this for us to help more people. Okay, Alexis is taking attendance. That's good. Yeah, Otis said we have 10 seconds left. Yes. Otis, are you seeing the timing? Yeah. Okay. So we are rounding off this section. Thank you all for joining, and we'll do the same thing tomorrow. What time do we prefer to? Okay, Otis is she's moderating for me, trying to find out who wants it and what time, because we have other people that missed today also. Probably because we did not. If we agree, I'm gonna place it on the channel so that they would know the time and prepare for it. Good job, Alexis. That's awesome. Okay. Do we have everybody in for tomorrow? Okay. What time? What time is best? Becky says 5. How many of us want 5 p.m.? Oh, okay. You forgot what? Beth says 5 p.m. Do we all agree on 5 p.m.? Otis says 5 p.m. Okay. Okay. Okay, so we're going to be live 5 p.m. I'm going to try to put it on the channel. Alexis is asking, I think someone, did anyone leave? Alexis, I think it's complete because I can see that number. So tell a friend to tell a friend that we're meeting, but I'm also going to try to update on the channel so that we can have it there so you don't forget. Okay, we're going to end it here today. It's been very, very interactive and very lively. I wish those of you who are testing very soon success. And remember what I told you, go in there knowing fully well you are coming out with success. Don't be afraid of anything. The examiner is human, okay? Do your best, be very interactive, talk to the patient one-on-one. It helps calms your nerve and reduce anxiety. So do that and let me have feedback on this channel, okay? I will see you all tomorrow at 5. Okay? Bye for now. Nate. Just trying to know her. Okay.